This is BoomerLife on CL 650.
You try to sleep.
And welcome back to the show. You're listening to BoomerLife on CL 650. We have Dr. Charnel Muir, the SnoreDentist, which is such a clever marketing moniker because it's very easy to remember, and the website's super easy to remember. It's SnoreDentist.ca.
Right. Dr.
John Remmers joins us from Calgary with a new testing procedure that's called Matrix Plus, and Dr. Muir is going to be the first snore dentist in Canada that's going to have this.
Yeah.
Now, Dr. Remmers, before we, I'm going to let Dr. Muir ask you a few questions, but in your long career following snoring and sleep apnea, how much better do the patients react to an oral appliance versus the CPAP machine?
It's very, very important. If you start someone on CPAP and then watch them over a period of 5 years, you'll find that maybe the 30% or so are still using it somewhat. So the long-term use of the therapy is very limited, Zach, and this is important because there are risks associated with sleep apnea. It can cause heart attack and strokes. So as a physician, we now know and understand well that CPAP has clay feet. People don't use it over the long haul. And, of course, I'm very much interested in the long haul. I'm interested in avoiding these devastating cardiovascular events. By contrast, the oral appliance is preferred. It is, as near as we can tell, used regularly by most patients. So we think that we'll have a much better outcome using oral appliances for those people who respond to it well and using the minimum amount of extension of the lower jaw.
Now, Dr. Muir, Dr. Remmers mentioned 30% stick with it over the long term for CPAP. Yeah. In your practice, do most people with an oral appliance, that's just their new normal?
That's right. It really becomes the new normal. And for a lot of our listeners, they'll be used to wearing a night guard or a retainer. They actually, when you go to bed without it, they notice that they have to get up and go get it.
It's like leaving the house without a watch. You feel different without it. Yeah.
It does. It really becomes the new normal. And it can take a few nights to become the new normal. Mm-hmm. But certainly a number of factors initially can certainly help the new normal want to be, and that is the bed partner that's not hearing you snore anymore.
And you're feeling rested.
And you feel rested, right? So if you happen to be the sleepy or fatigued patient, that really is critical.
So this is a new test that's coming in soon to Dr. Muir's practice called Matrix Plus. Now, do you have any questions for Dr. Remmers?
And one of the things that I know that my patients will want to hear is, well, really, it's just a gimmick. Well, really, it'll be a positive test for everyone. It's just something to get a piece of plastic into my mouth. And it really isn't, is it?
Exactly. No, this is to try to change the whole paradigm, the whole method. As you pointed out, until now, the traditional method is trial and error, or some people would say catch as catch can, and you just more or less blindly applying this treatment. Now we know in advance how it's going to work out, how successful you will be, and where to set the lower jaw. And that's all based upon hard evidence. This is based upon clinical trials carried out at the University of Calgary, approved by the review boards there, with very careful attention to details. This is what's required to be able to have your device approved by Health Canada or approved by the FDA in the United States. So the other dimension that indicates the quality of the science that's backing this up is that it's published in the best peer-reviewed journals. so that there's no doubt that this is solid science. It's what we call evidence-based medicine, and really it's what our last president, Obama, down in the United States used to talk about. He called it precision medicine. So the idea is that we're going to try to get the right treatment for each patient, and that will allow better outcomes and more efficient and cost-effective delivery of health care.
So can you describe how excited you are about having this new test and what it's going to mean for you as the SnoreDentist?
You know what? I don't know that I can. I have been waiting for this for years.
Mm-hmm.
I literally, every sleep medicine meeting that we're at, I look at Dr. Remmers and I go, now? And he's like, soon. It's just been, I've just watched it develop. I'm so excited.
Back to Dr. Remmers' point is that the good thing is that you do have to do all of this testing. You can't just come up with something and then put it in the marketplace. There's a long process, right?
It really is. And in order for me to be confident in it and know that my patients will be able to wear it, they'll find it acceptable, like he said in the studies, vast high rate of acceptance, and that it is confidently predicting what that patient's response will be. Yeah.
Dr. Remmers, when were you ready to move forward with this? You had to go through all the bureaucratic steps, but when did you know it was going to work?
I was actually astounded. We had the idea that, first of all, we had an in-laboratory test that would do the same sort of thing, but it required a human being to click the mouse and move the lower jaw back and forth in response to difficulties that were being in breathing that were being observed. So we said, well, gee, that's inconvenient, costs too much, people don't want to do that. Let's make it for the home. And I didn't know that it would work out. Actually, it was a really kind of a long shot. I thought, well, not so. It turns out people accept this very well. A person takes the device home and puts the probes on as usual, with the way you did, Zach. But in addition, sticks this thing in the mouth, goes to sleep, and has a good night's sleep. So that we learned a couple of years ago, and I've just been waiting on bated breath ever since for the chance to get it out there and see what the marketplace thinks, see what people like Dr. Muir think. All across Canada, we will have some response now, and but all I can say is it's so exciting to begin with the top quality dentist in our area. That's the very best. So thank you, Dr. Muir, for taking us on and showing this to all of your potential patients.
Yeah, I can't wait for them to start using it. I really can't. It's going to be so exciting.
Now, why did I have my test done with the old system? I want the new system.
You get the new system for your dynamic and static study. You still had to do a diagnostic.
I still would have had to do a baseline.
Absolutely. You still had to we still had to diagnose what we were going to treat.
I see.
Yeah.
That's right.
Yeah.
The first test that you've already had tells us where you are right now, Zach.
Yeah.
But then we also want to know, how's it going to go when you put this oral appliance in your mouth? Are you going to have a great response or not? Are you going to where should we set the jaw? What's the dose of the drug we need to give you? Mm-hmm. And that was all kind of guesswork before. So now we brought it out into the light. We'll be able to do it objectively based upon good science. And I think you will enjoy the next test. So I'm looking forward to that, Zach.
Well, my kids thought I looked funny wearing all this gear.
Well, they're going to think you look even funnier, I can tell you.
The good thing is you're at home by yourself, as you mentioned.
And your kids are your best critics, aren't they?
Yes. They're never shy to tell you anything.
No.
And, well, I'm just so glad that you don't have to go to a sleep lab to get this done.
Yes.
You can just do
Precisely.
it. And, if it does take a little longer to fall asleep, that's fine. But you will get to sleep.
Yeah. But if you went to the sleep lab, Zach, a 95% chance they're going to slap the dreaded mask on you in the middle of the night. 95% chance. Okay, so here you're out of that system. You're not going to be driven toward this one treatment, the only treatment in many physicians' minds. Now we're moving towards an alternative treatment that's also well-based in evidence.
That's the voice of Dr. John Remmers, who's based in Calgary. Dr. Muir, thank you for being on the show again, the SnoreDentist, SnoreDentist.ca. So when is the Matrix Plus test coming to your practice?
We're going to start setting dates. I'm actually speaking with them tomorrow, and then we'll have some delivery and installation dates after that.
All right, so it's very exciting. So anybody that suffers from snoring, or somebody in your house does, or maybe thinking they have sleep apnea, this is the route to go, and check out Dr. Muir's website, SnoreDentist.ca. Thanks to both of you for joining me today.
Oh, thank you, Dr. Remmers.
Thank you, Dr. Muir. Thank you, Zach.
And we'll speak to you next time with the SnoreDentist on CL 650. Thank you.